My name is Clara Atieno Odhiambo. I am a general surgeon from the Republic of Uganda. The Merck Foundation scholarship in surgical oncology was recommended to me by the Minister of Health of the Republic of Uganda. The Republic of Uganda faces a lot of challenges in terms of oncological care. There are still very few surgical oncologists in my country. The number is actually less than 20 for a population of 40 million Ugandans. Whereas the country is building capacity to increase oncological services throughout the regional referral centers, the human resource remains a vital component. In Uganda, I feel the two main things that could be improved to see oncology services reach the population would be infrastructure in terms of diagnostics and human capital. I would encourage that as many specialists are trained, now that I've said the country is building capacity, I would also encourage that we have as many collaborations as possible. Sometimes it's difficult for people to go and train, but we would invite teams to come and collaborate with us and teach us the skill while we are at home. This training is important for me because through it I gain skill, and this skill does not go to waste. This skill is translated into patient care. I am happy to say that I'm not going to be the only oncologist, but that I'm going to be part of a team that is going to help Ugandans in managing the oncological challenges in the country. So I would say I had a lot of expectations. I expected a lot of hands-on training, operating here and there all the time, which I did get some opportunities. I also expected a sort of structured curriculum through which I would follow, and that I found a bit challenging. There was so much to learn, but it was not in a structured way that I had expected. So in BBCI, the exposure is great. There is so much to learn, so much that I encountered, so many cancers. I never imagined that I would come to a place and just see cancer all the time. So I've seen a lot of gallbladder cancers and received a lot of exposure in terms of how to operate on them. There's also a lot of stomach cancer, head and neck cancers. I've done a lot of breast cancer. So it's been wholesome exposure, seeing every sort of cancer. And particularly for me, my interests were in gastrointestinal cancer, colorectal cancer. I would say that the exposure was adequate for me. So I feel that my biggest role would be one of creating or building capacity, creating teams that can work together rather than doing a solo show. So to the new aspirants of the Merck Foundation Surgical Oncology Program, I would say learn as much, make use of every opportunity. I can't say that I've gained it all, but this opportunity has surely been a stepping stone in my career. So grab it with all that you have. It's just a year. You compete with people who are doing the course for 4 years, so all odds are against you. But with strength, with vision, you can do it. So to Merck Foundation, I would like to say thank you and thank you and thank you. It's been an immense and great training opportunity. Not having to worry about costs, sailing through well, for that I'm really, really grateful. To BBCI, thank you for the warm environment in which I was able to study. I did not feel any prejudice or pressure training in this place. To the patients who offered themselves for me to train on, I say thank you very much. And to the Ministry of Health, to the Minister of Health of the Republic of Uganda, I would have not been here if you had not endorsed me. Thank you. Uganda!